And we are ready to begin. Welcome, coalition partners and friends in the Hampden-Wilbraham community and beyond. My name is Gina Kahn. I am the director of the Hampden-Wilbraham Partners for Youth Drug-Free Communities Coalition, and it is my pleasure to welcome all of you here tonight to our webinar, Parenting Now, Coping in the COVID World. We'll be introducing our panel in just a moment. And panelists, if you want to turn your cameras on, it'd be great if we could get a little peek at you. Thank you. And I also want to take this moment to say a big thank you to Kate Belsky, Executive Secretary for the Superintendent Hampden-Wilbraham Regional School District, who is acting as our tech facilitator tonight. And Kate, with that, can you show us the next slide? Thank you. So I want to share a little bit of information today about why we're here. And we are here being hosted by the Hampden-Wilbraham Partners for Youth. We are a coalition, a community-based coalition. We represent a diverse group of community members, everyone working together for the common goal of reducing teen substance misuse in that broader context of promoting physical health and mental health and safety for all Hampden-Wilbraham students. We strive for a coordinated, comprehensive, collaborative, and sustainable plan of evidence-based activities and services to prevent and reduce youth substance use and promote healthy childhood development. Our activities focus on increasing awareness of community activities, environmental strategies, and local policies that lead to a shared responsibility of the roles that all of us play in teen substance misuse prevention, increasing protective factors and decreasing risk factors. And Kate, thank you. Who are we? What you see on this slide is a nice representation of our coalition and who is represented. And the point here is that the Drug-Free Communities coalitions are designed to be community-based and to reflect all of the different stakeholders who play a key role in creating a healthy community environment that provides those consistent messages to our youth that we want them to grow up safe and strong and substance-free. This work cannot be done by any one individual or any one agency or any one constituency alone, but it requires all of us to work together as partners in prevention. If you are with us tonight, then you are already part of the equation. And I'm sure as you look on this list, you see at least one or two, or maybe several areas that you can relate to. But I hope that you will consider visiting our website and you will see it there on our little logo, hwp4y.org, and thinking about and learning more about the coalition and how you may become more involved. Can we see the next slide, please? A few things about logistics tonight. I think we are all, for better or for worse, pretty familiar with the Zoom world now. Please know that only panelists will be on video and audio. You may submit questions via chat. We've already gotten some questions in advance through the registration opportunities, and our panelists will do their best to answer questions as time allows. The webinar is being recorded, and the recording will be posted on the coalition website along with a session summary and a Q&A summary and that great resource guide that we will be sharing with anyone who has pre-registered by email. At the end of the program, and actually a little bit before the program, you're going to see a QR code that's going to send you to an evaluation. And I really, really want to emphasize that it's so important that we get your feedback. And so please take a few minutes to let us know how tonight has gone for you and what topics you might like to hear more about in the future. And can we see our next slide? Tonight's topic is something that I think we've been looking forward to, because in that description that I just shared in terms of who we are and what the coalition works on and what we all collectively care about, our world has certainly been greatly transformed by the pandemic crisis of these past 10 months. And the coping aspect, the being able to navigate those ups and downs and those challenges are definitely something that I think taxes all of us, each in our own way. And so our webinars this year have had that element of how to promote healthy coping skills. And we are very fortunate tonight to have our friends from MassSupport, and specifically Sarah Geyer, as you can see here, senior team leader on the Western Mass team. MassSupport is a FEMA-funded program, and I think she'll tell us a little bit more about it when she begins. I also want to mention that we are very fortunate to have several members of our larger community of mental health resources with us tonight. That includes Kim Lee from the Mental Health Association, and it includes Kathleen Cordier from BHN, the Family Resource Center, and Hampden-Wilbraham's own Carrie O'Connor, who will be helping to round out the picture by giving everyone a little bit of an idea of how to navigate some of these challenges that you may be facing. With all of that in mind, it is my absolute pleasure to introduce Sarah Geyer, and Sarah will take the microphone.
Thank you so much, Gina. I really appreciate being here tonight. I also want to thank the Hampden-Wilbraham Partners for Youth Coalition in general, just for all of the wonderful work that you do in your community, working to help protect and build healthy young people, which of course is especially challenging today compared to in times in the past where it was already challenging enough. I also want to give a big thank you to every single person who has chosen to spend their night with us tonight. I think we all know that most of you are probably really zoomed out, and at the end of the day, what you want more than anything is to put on cozy slippers. I hope you already did, and just sort of zone out and not think about COVID-19 or be stuck on Zoom again. So we really appreciate your time and your choice to spend your valuable time with us tonight. To tell you a little bit more, and I'm actually going to go more in detail at the end of the training about all of the services MassSupport offers, but MassSupport is a crisis counseling program that is funded through FEMA. We've been in operation before. In fact, myself and a couple of our other team members were part of the crisis counseling program that responded to the tornadoes in 2011. So we are very familiar with the Hampden-Wilbraham area and have done this work in these communities before. If I could have the next slide, please. Perfect, thank you. So I want to just start off by talking about what we know happens when we're in the midst of a disaster. This is something people don't think about probably very often. And yes, unfortunately, we are in the midst of a disaster. But COVID-19 is different. So the next slide I'm going to show you, not ready to move yet, but is going to show you how it's different. But just to talk a little bit about what we expect, what we know is pretty common. This is a SAMHSA slide that looks at the phases of a disaster. So you see there we have the warning and the threat. If we were to think back to 9/11, we actually really didn't have much warning or threat for 9/11. But for the tornado, we maybe had a couple of hours of warning that there was bad weather coming. And then that impact happens. So the event occurs. And then we move into the heroic stage, and you all know exactly what this is. The heroic stage after 9/11 looked like people making cookies for local fire departments and police departments. American flags were going up everywhere. Of course, you know, the honeymoon phase, we see that community cohesion where people really, really come together. So in COVID-19, for lots of us, that looked like the hearts going up in windows. People really trying to band together to figure out how to help one another. But under most circumstances, we then see this disillusionment phase, which often can last, as you see here, up to the anniversary. And sometimes for some people beyond that. But the disillusionment phase is when people are starting to get tired. They have fatigue, they're frustrated. The cohesion, the community cohesion has started to wear off in many instances. Some people go right from the honeymoon period and move very quickly into reconstruction. So this is really not about how each individual person responds to the disaster, but how a community often will respond. And so then we see that this disillusionment happens. And what that can often look like is people are getting very irritated with each other online. I don't know if any of you happen to be on social media. That's a little bit of a joke because most people are now, but and noticed the anger that we saw coming at one another during different times, even still. And usually we take that very much at face value, that people are that upset because of a specific issue that they're arguing about. But from my perspective and the perspective of a disaster, I would argue that maybe this disillusionment may be fueling some of that agitation in our communities. Under normal circumstances, we then reach that anniversary, which is why the crisis counseling program is generally designed to last for about a year. So it actually gets us right to that anniversary marker. And then we see that the reconstruction has truly started. You see the little bumps in there, that's recognizing that there can be different trigger events. When we did work with the Boston Marathon, we certainly saw anything about the bombing that hit the news was a trigger event and could really bring up a lot of distress that people had that had subsided a little bit, but then the news really antagonized that distress again. If we could go to the next slide, please. There should be one more slide in between. And there is not. Well, so you don't get to see my lovely art. Nope, sorry, if we can just go back to the other one, sorry. You don't get to see my lovely drawing. What I did is I basically took a marker and I scribbled all over this to show what it looks like in COVID-19. And the reason, if you can imagine my scribbling all over this, is because we went through the honeymoon period. We saw all of the hearts up. We saw people really trying to band together, being out there supporting our essential workers. But unfortunately, we are also seeing the disillusionment while still living in the event. Unlike most other things that we've experienced, at least in my lifetime and in this work, the impact, this event has been going on for a year now. Whereas normally when we talk about disaster mental health, we're talking about an event that happened maybe over minutes or hours, certainly not over years. So I say that because we're not just in potentially the disillusionment phase, but we're also trying to manage our way through still living in the event, which makes COVID-19 unusually complicated. I am ready for the next slide. And I'm so sorry that you all missed out on my beautiful artwork. And if we can bring that up. So in the crisis counseling program, we spend a lot of time trying to just provide people with information about the ways in which toxic stress can wear on them and what types of experiences can lead to this toxic stress. And actually, Kate, if you could just click a couple more times so it brings the rest of the information up on that slide, thank you. So when we ask ourselves what types of circumstances or situations would be likely to cause toxic stress for people, there's a couple of hallmarks that we look for. We look for a situation that causes a sense of loss of control, a sense of vulnerability, and a sense of immobilization. Historically, pre-pandemic, when we talked about this, we were talking about things like combat, potentially a sexual assault, domestic violence, those types of issues. But of course, COVID-19, perhaps more than anything else that I've seen in my lifetime, absolutely has created all of these. Most of us feel that we have very little control over the circumstances that are going on around us. There's a vulnerability. Some people refer to this as an annihilation event, which feels like a really dramatic term, but what that's meant to describe is that we're living in a circumstance where there's a threat that's always around us. And many of us are really aware of that. Many of our children are really aware of that. And then the immobilization. And for us with the immobilization, sometimes that's quarantining, but many people are staying at home, trying to avoid going out in public. And so there's inherently an immobilization in that. Kate, if you could just click a couple more times. So that traumatic stress usually includes that the experience is overwhelming, that there's a threat to our physical and or our mental well-being, which of course we are all living with that threat, and also a threat to our loved ones. So for those of us in the audience who, aren't particularly high risk, we may not be so much worried about our own safety, but we're really worrying about other people's safety and our loved ones. I think there's one more bullet point there, Kate. Thanks. And that feeling of helplessness or fearfulness. And again, that's something that most of us are experiencing in the context of COVID-19. The reason that I'm showing you all of this isn't to make anyone feel more alarmed, but just to really acknowledge that if you're feeling alarmed, if you're feeling distressed and worried, there's a reason for it. It's because we're in a really stressful period right now. And next slide, Kate. Oh, and the impact on relationships and belief systems. And certainly, just this morning, I had a staff person talking about parents who are really worried about their kids growing up being afraid of touching people and talking, being close to people, and that we've all kind of learned to turn our heads. So certainly we are experiencing that impact on our relationships and belief systems. Thank you, Kate. Next slide. So we often talk about what are our normal assumptions when there is no threat. And if we think back to before COVID-19, most of us felt in control. We felt safe when we went to the grocery store or had to go into our offices. Certainly, we felt the world was hopefully a meaningful place. And also, if I was to ask you how likely you thought it was that we would face a pandemic that would last for an extended period of time and lead to many of us having to work from home, our children not being able to go to school, prior to COVID-19, I think the odds are good that you would not have thought that was likely. And those were the normal assumptions that we had. And if you can go to the next slide, Kate. But what happens when we have a potentially traumatic event is that our normal assumptions are shattered. And what that can look like is that we don't feel like we're in control. We don't feel safe. We may not feel that we're worthy. We're hearing a lot of that around vaccine guilt, because certain groups of people have been prioritized. And in some cases, those groups of people are otherwise relatively healthy people, like first responders, those of us in the medical field and mental health field. And so there can be some guilt and some sense of I'm not worthy of getting this vaccine because there's other people at higher risk. It's a really common experience when we're going through a potentially traumatic event. It can feel like the world's not a meaningful place. And we can start to be fearful that any of these things can happen to me or to the people that we love. And so this type of an experience can really shift our sense of safety in the world. And you, of course, for any of you old enough, which is probably most of us, to remember 9/11, remember the way that we felt about the world before 9/11 happened versus the way that we felt about the world after 9/11 happened. And so this is something that most of us have been through before, and we know that we're not going to go back to those normal assumptions. We're going to find a new normal, and the jury is out as far as what that's going to look like for all of us. If we can go to the next slide. Jenna, I realized I haven't done much pausing. Are there any questions that I should answer? I'm going to assume not. Okay, good. So I want to talk just for a moment about the domains that are affected by trauma or highly stressful events. So this graph looks at both the immediate impact and the long-term impact. The immediate impact, most of us can relate to this, that acute stress response, the hyperarousal, the hypervigilance. How many remember scrubbing our groceries down with Clorox wipes? How many remember the panic when we couldn't find the Clorox wipes? That high level of anxiety, that threat system is really, really activated, is an entirely common reaction in these. And in fact, I would argue it actually tells you that your threat system is working correctly. Our bodies are meant to respond to a threat. So that immediate impact is very, very common. We also see with that neurological reaction that the key survival systems, which I could give you a very long and potentially arguably boring description of all of the ways in which your brain is operating, but basically what happens is the threat system activates, and when it activates, it shuts down your frontal lobe. I won't give you all the boring details of that, but what your frontal lobe does is it keeps you organized. It is in charge of storing your memories. So if you found in the early days or even now, that you were having a really hard time being organized, keeping things on track. You just felt really spaced out. All of those things are really, really common reactions in this moment. And again, what that tells us is that your threat system is activated. We see that there can be shifts in our ability to engage with other people. Sometimes, especially with children, we may see an overdependence. So if you found your children had been doing a fantastic job sleeping back in their beds or in their beds to begin with, and all of a sudden they were back in yours, that is not a surprising reaction from children. They can sometimes, they meaning any of us, sorry, can feel really disconnected from people. Sometimes the way that people will demonstrate that is they may appear very blunted, meaning when you're talking to them, they're not really engaging much. They seem kind of flat. And on the flip side, sometimes what we see is that emotions fly really, really, really high. So the exact opposite. In fact, I would say if we look throughout the last year, we have seen an awful lot of very high emotions. And not to say that people don't have solid ground to be upset about different issues, because they certainly do. But I would also argue that there's a good chance that the amount of impact that we've all experienced from the trauma and toxic stress of COVID-19 may also be fueling some of those reactions. So if you find that your children are abnormally emotional, or that you are abnormally emotional or reactive, please try to have some patience and forgiveness for them and also for you. That's really common. And then, as I had mentioned before, having really that difficulty in processing information, but sometimes we see that there's a lot of blame. And again, this is all the immediate impact, but in a way, we're all still living in the immediate impact. And so all of these things would apply. We see shame, we see guilt, we see blaming, and we see anger. And so some of you may have seen, especially what I witnessed early on in our program working with schools, is that they were getting a lot of angry calls. And so we really tried to help the staff to recognize that, not to say parents don't have very legitimate frustrations. However, they're also being influenced by their own stress levels because of what's going on. So then we also look at what some of the long-term impact can be. In some cases, and I want to be really clear, our research indicates that it's less than 10% of the population that are going to have these long-term impacts. But in some cases, people can have difficulty regulating their own physiological responses. Sometimes they have what we call a sensitization of the survival pathway. And what that can look like is they may be really jumpy or quick to go into that fight or flight or freeze mode. There can be times where there is lasting impact on relationships. Difficulty managing and identifying their emotional experiences can happen for people. And sometimes we hear people talk about numbing. Again, the majority of people who go through these experiences, once they get to that recovery period, they're going to recover, and they're actually going to do it fairly independently. But we are always, as the mental health field, trying to get out to the people who we know may be struggling for that recovery. That's often going to be people who have had a lot of other traumas in their life. And so that makes them more vulnerable to struggling in that recovery process. I did see that we had a quick question.
Oh, yeah. So, Sarah, there was a question from Nikki. Do you look at these impacts in the geriatric community?
I want to be clear. I know that people are looking at it. That has not been my area. I can say, that we are starting to do some work with some of in the nursing homes throughout the state, and we're also doing work with caretakers. Pretty consistently, we're seeing that these reactions are pretty common, but it's also mixed with a lot of other things. Part of what I'm seeing a lot in the geriatric populations I'm working with, so I don't want to give this as a research-based answer, but I'm definitely seeing a lot of grief. And we're seeing grief throughout the lifespan, but it seems to be even more kind of persistent in the older populations, which really does make sense, because as we get older, time often becomes much more valuable. So I would say if we're talking about the geriatric population in particular, I would want to think a lot about the grief component as well as all of these. As far as actual research that looks at the impact of trauma and toxic stress, I would be happy to look that up, but I'm not an expert in that area. I see we have another question that just came in.
So the next question is, how do we help children who might have other ACEs and may respond by shutting down? Remote learning makes it easier for students who are home to disengage.
Yes. I'm going to ask you, Jenna, to ask me that again in this next slide that we're moving to, because it falls into a little bit of what I'm about to talk about. Thank you, Kate. So this is the how do we try to avert as much of this as possible. I am not a doctor. I do not even play one on TV. However, this is a prescription that even I am allowed to prescribe to people. It's a little bit simplistic in some ways, so I'm going to break down piece by piece. You know, when we think about protecting our children, one of the things that is really, really important is making sure that we're taking good care of parents. And sometimes those parents are the parents of your students or your patients. If you work in the medical field, sometimes those parents are ourselves. You know, we often focus so much on the children, which is really important. But the truth is, and you've all heard the saying, if mama ain't happy, ain't nobody happy. And there's real truth to that. If mom and dad are distressed, if mom and dad are drinking too much, if there's violence in the home, those kids are vulnerable. And so one of the most important things that all of us can do if we're parents is take good care of us. So positive attitude is a little bit overly simplified, but really focusing on our own self-care. And then this cognitive flexibility through reappraisal, what that means is really working to be willing to reconsider things. Sometimes, for example, we might have a family that gets really stuck on being mad that their kids aren't in school. And I understand that. And I understand all of their concerns. But the reality is, going back to one of my original slides, we're all somewhat powerless in that right now. We can make phone calls, we can advocate, but at the end of the day, either the schools are open or they're not open. And we have to be able to reappraise the situation and figure out another way to address what's going on at home. And so that's really, really important for us. You know, also looking for people around us who are managing really well, and what are the skills that they're using? What are they leaning on to be able to do that? You know, and nurturing our social network. And I know that it's hard. We were actually just talking today about how in the old days, you know, when you went to a meeting, there was social time before and there was social time after. And so now we're all showing up to Zoom. The meeting starts when we show up, and then it ends when it was scheduled to end, and we all leave. And we're all really missing that social connection with other people. And so really being intentional about trying to maintain social connections. Excuse me. And I cannot overstress the importance of our own physical well-being for us and for our kids. So making sure that we're eating right, that we are getting lots of water. It's not unusual when people are stressed out, we drink too much coffee. Sometimes people are drinking too much alcohol. In fact, one of our surveys that we put out very early in the pandemic showed a lot of people reported that they were drinking more than normal. So being really aware of those things and making a pointed effort to take good care of ourselves. When we talk about the physiological reactions to this stress, your body holds it all in. And one of the best ways to get that stress out is physical movement. And so I know lots of people are not going to the gym, and I'm not here to recommend the gym, but definitely to get out and walk, or if you have a stationary bike at home, if you have one of those little exercise trampolines, if not, even just doing jumping jacks in your house. Anything that's getting your body moving helps to move those stress hormones out of it. This is also really true for kids. Our kids are pent up, they're frustrated, they're lonely, they're tired. So getting creative, whether it's doing a family yoga night or making sure to take them out to ride the bike. Yes, it's cold, but I was just informed by my supervisor that we can actually really bundle up. So I gave it a try. I bundled up, I put my earmuffs on, and it worked. So even though it's cold, we can still try to get outside. Maybe not when it's 13 degrees, but when it's not that cold, And that physical movement is really, really important. So you see your kids are getting antsy, they're frustrated. Try to think of something creative, and dance parties in the kitchen are really underrated. Kids love them and parents love them. So that is a definite recommendation. You know, another point I want to make about that is it's really important for all of us to find things that we're looking forward to. You know, what we're hearing from a lot of families is the frustration about not being able to have vacations planned and not being able to have birthday parties and weddings and all of those things that used to really be exciting and something for us to look forward to. So what we encourage people to do is be creative about those things. No, we can't throw birthday parties the way that we used to. But people have done a lot of really creative things like the drive-by birthday parties, or, you know, having pods of families where, you know, two families are not interacting anywhere else, but they are interacting with each other. So they're expanding their own home. There are ways for us to make life still enjoyable and have things to look forward to. And that's really important for us. And it's really important for our kids, because we all now truly understand what Groundhog's Day feels like, including our kids. So we have to try to find ways to spice this up for them. And I would also say, as the very proud granddaughter of a 98-year-old, she's also, for the person who asked about geriatric people, she is really experiencing Groundhog's Day. And so, you know, to make effort and to be thoughtful about the people in our lives who may be experiencing this in an even more difficult way than we are, and how do we help give them something to look forward to? I've actually recently taken on a postcard campaign. I joke that I am single-handedly going to keep the post office in service. So what I do is I send out 4 postcards to random people every week. And it makes me feel like I'm doing something meaningful. And it also is just a nice surprise for people in their mail. I don't know about you, but most people, I think, are mainly getting bills, which is not uplifting. So a postcard and a card can just really brighten someone's day. And then this last one, to recognize and utilize and foster signature strengths. So what does that mean? What that means is our brains are programmed to often focus on the things that we don't think we're good enough at. So for those of you who wake up and are frustrated with yourselves because you weren't good enough on your diet, or you didn't return all the phone calls you feel like you should have, that seems to be human nature, that we spend a lot of time criticizing ourselves and often other people. What we're encouraging here is to actually flip that and to spend time really recognizing what it is that you're great at and what it is that your kids are great at. So some kids are doing just fine with remote learning. They're self-motivated, they're able to sit still, they're able to keep track of all their assignments, while other kids are really, really struggling with it. It's easy to get frustrated, but what I would encourage you to do is look at that kid who's struggling and ask yourself, what are they really good at? And how do I bring more of that opportunity into their life? And I know this is tricky, because oftentimes you're going to say to me, they're really good at sports, which they can't play right now. We have to be super creative. And sometimes it means that we're playing with them. I know you're all really excited, but that would mix together their signature strength and your physical activity. So it's actually a win-win. You know, really thinking about what is it that all of us are so good at, and how do we create more opportunities to focus on that sometimes. I appreciate the saying, what you water grows. If what we're watering all the time is all the things that are going wrong, or all the things that our kids are struggling at, then in our minds, those things grow. So what I encourage people to do is think about, how do I water the other things? How do I water the things that are so special about myself and my kids? And try to make those grow just a little bit more. And the next slide, please. So I want to just take a moment, tell you a little bit about more about MassSupport Network services. We provide, all of our services are confidential, anonymous, and free. When I say free, they're funded through FEMA. So they are being paid for by someone, but they are free to all community members. We provide one-on-one support services for anyone who wants to talk to a counselor. We are not therapy. So if somebody's looking for therapy, we can help get them to that. But what we find is that a lot of people maybe just need a little bit of help moving through whatever situation they're faced with in that moment. We do provide group services for adults, children, and youth. We work with employees and also with communities. And I see Gina just answered that we will get back to the ACEs question. I can answer that really quickly. The question that had come up was about kids with underlying ACEs and their risk, specifically to the way that they're impacted now. So the question that was asked is, how do we help those children who might have other ACEs and respond by shutting down, remote learning, making it easier for students who are home to disengage? Gina, you just popped on. Do you want to hold off on that?
We don't need to hold off, but what I did want to ask you is if you could just take a pause to tell folks what ACEs are.
Yes, thank you so much. Oh, thank you, Gina, for pointing that out. Yes, the ACEs, it's called the Adverse Childhood Experience Study. And so what that looked at, there's a website that I love. It's called aces2high.com. And that's 2 as in 200. And what the ACEs looked at is a specific set of experiences that a lot of children have. Some of those are having experienced physical abuse or neglect, having been sexually abused, having a parent in the household or a household member with a substance use disorder or a mental health condition or domestic violence in the house. And so what it really looks at is, what is the correlation between those experiences and later in life health outcomes, both physical health outcomes and behavioral or emotional health outcomes? The research is incredibly important because what it shows us is not only are there behavioral health issues that kids with higher ACE scores are very, very susceptible for, but there's also physical health outcomes. The reason that's so important is it shows us the impact of toxic stress on little people. So for those folks who come from the school of, pull yourself up by the bootstraps, the way that I think about it is kids with those elevated ACE scores don't have bootstraps. That those adverse childhood experiences basically took away those bootstraps on them. And so as a community, our job is to help figure out how to give them that boost that they need to help them through it. So when I think about those kids, which to whoever asked that question, I'm sure that you're well aware that those are the kids we are especially worried about right now, because so many of them may still be in homes or are in homes where those adversities are still occurring. So we're worried because they're not going to be getting necessarily the eyes on them that they would get if they were going back into school, but also just the time out of the home. I don't know if you all know this, I'm guessing you do, but our research shows that just one trusting adult, oftentimes in school, can make the difference between a kid being at high risk for suicide versus a kid who's not at high risk for suicide. So we know that having those kids not in school is concerning. I would like to give an opportunity, because we have a wealth of knowledge, to circle back to this. But again, I'm going to say that one of the most important things that we can do here is, one, make sure that to the best of our ability that we're helping have a healthy family, right? The best thing we can do for those kids with those ACEs is make sure that their home is stable as best as we can, but also is, helping to focus on their strengths. The more that we pick at kids who are struggling, the more they shut down. And so oftentimes, really being able to help when they're not in that shutdown mode, emphasize the things that they're doing well is really important. But Gina, can you make sure we circle back to this in just a moment with the panel?
Absolutely. And I know that some of our panelists will be very eager to revisit this. And I do want to point out that ACEs are, as you said, very typical, and that even in our adult lives, we may in fact be seeing those reverberations of those adverse childhood experiences that we may have experienced. So it's very pertinent to this conversation because we're talking about things that get processed as trauma. And if someone already has a trauma history and we are in this trauma bracket, of course it is going to be more prominent, more pronounced, and more difficult. And I know some of our panelists are probably very much itching to get into this discussion as well, in terms of some of the strategies of consistency and predictability and which is harder in this environment without a doubt. But I think at what Sarah said, ACEs are real, and it requires us to work a little and sometimes a lot harder in supporting our youngsters and maybe even ourselves, because we have a mirror here as well in these difficult times. With that, I'm going to shut my camera now and let you keep going. Thank you.
I'm just about done. No, thank you. It's important, very important conversation. So just a little bit more on what MassSupport services are available. We do have educational presentations just like this one. We also help with coalition building. Because we are a temporary program, we know that the real strength and power is in the pre-existing community organizations. So our goal is never to come in and take over the amazing things that other people are doing, but rather to help build bridges. And the next slide, please. And this is the work that we do on a community level. So we often help provide information on normal reactions to these events. We provide coping tips and guidance on working with children, support families, workplaces, and communities. And again, we build those bridges, which to me is one of the most important things that we do, is build bridges. And our last slide. You know what? I think that you probably aren't worried about what model we use, but we do use a model called psychological first aid and skills for psychological recovery. As I told you, we are not therapy. We are very intentionally not therapy. So we're there to be that bridge sometimes that people need. Oftentimes it doesn't lead to people needing anything else, but sometimes it does, and we help make that connection as well. And I think I covered everything else there. The next slide, please. So just want to let you know about some national and state resources. You're going to hear about all of the amazing local resources that you have, but want you to know Mass 211 is available to you. Mass 211 can provide information about any practical needs that you might have, including any issues around housing or rental assistance or health insurance or questions with around the vaccine. The National Disaster Distress Helpline is available as well. And the National Disaster Distress Helpline does outlive MassSupport Network. It is around all of the time, as well as the National Suicide Prevention Lifeline, which is also available at all times. And I think this is my last slide. Okay, next one. So if you'd like to know more about us, please feel free. We are on Twitter and on Facebook. Actually, as of recently, we are also on Instagram and on LinkedIn. Please feel free to check us out and learn more about us. And one more slide, which is just me and Anastina. And that is it for me. Thank you again so much for all of your time tonight. I want to turn it over and give time back to this amazing panel.
Sarah, thank you so much. And I hope you'll stay hanging there with us, because I'm sure that there will be more questions and more things that will resonate with you as you hear about some of our local resources. Kate, can we look at the next slide, please? So remember, I promised that you would see a little QR code here, and it is here. This is your link to the evaluation. And I am going to also, I was remiss in not introducing Jenna Swachak. Jenna is our relatively new, although she has now been on board for a couple of months, coordinator of the Hampden-Wilbraham Partners for Youth Coalition. And it has been a delight to welcome Jenna to our coalition family. And she's with us tonight. She's been helping us process questions as they've come in. She's also going to help us with kind of be the relay station for the questions that had been shared prior to. And this is the place where I would invite you all to please use that chat box to add additional questions. And Jenna, in the process of our Q&A here, I'm also going to ask you if you can access the link to the evaluation and stick that in the chat box, because I realized that I should have had that next to the QR code, which may or may not be helpful to people. The next phase of our program tonight, and I do want to give a huge thank you to Sarah. And before we move into the panel, I also really want to emphasize that our enthusiasm and excitement for bringing MassSupport here tonight was, first of all, because we knew the work that they were doing statewide around coping with COVID, to help us normalize those things that are uncomfortable for us right now, because we are all very much feeling, to some degree, everybody to a different degree, but we all have a little piece of these things that may be going on for us. And to be able to hear in Sarah's clear and reassuring tones that what we are going through makes sense. And yet we can be empowered to take action, to help ourselves, to build up our own protective factors, to be able to cope with something that we could not have possibly imagined. And we sure are in an unimaginable world right now. And we look forward to things getting better, but we also know that our seatbelts are fastened, because it's going to be a bumpy ride from here to there. In the meantime, however, and I also want to say the MassSupport resources were so appealing as a pivot point for this presentation tonight, because they are available to all of us. This program is here, and it is FEMA and Department of Public Health sponsored, or is it DMH or DPH? I don't remember, Sarah.
The Department of Mental Health.
Thank you. So Department of Mental Health and FEMA, who have allocated resources on, and Riverside, the trauma center, being that center for the distribution of these resources in pockets across the state. And the session that you had tonight is something that can happen in any environment and has been happening across the state. I am familiar with school districts in the East Coast that have shared this same presentation or similar presentation for their staff, for their families, for their community. And it is relevant. And then it becomes the conduit for those additional resources that Sarah was talking about. And as she said in the very beginning, and I was paying attention to this, they are anonymous and they are free. So I want everyone who is listening tonight, or maybe listening to this program after the recording is being shown, not to forget that there are available resources in that wide state level. And we are very fortunate that we had Sarah tonight to give us a little tour of that. But then comes the question, so what about locally? And for that, we have assembled a panel, and in the little bit of time that we have left, and we did say 8:15. I want to confess that in my head, I'm kind of hoping that we will be able to say goodnight a bit earlier, but I wanted to give space for the questions that might happen, and room for people to have a chance to discuss. So I'm going to introduce you to three amazing coalition partners. And I'm proud to say also friends who have been part of our journey and recognize that this is work that we all share, and they definitely do their share of the heavy lifting to make our communities stronger and safer and healthier. And Kate, could you give us the next slide? Our first panelist, and each panelist is going to tell you a little bit about their organization and maybe a little bit about their resources, and then we're going to dive into the questions. So it is my pleasure to introduce Kim Lee, the Vice President of Resource Development and Branding for the Mental Health Association. And Kate, next slide. And Kim, can you say hello?
Sure, absolutely. Good evening, everybody. And wanting to echo Sarah's thoughts earlier when she started her presentation, and that is to just thank everybody for carving time out of your very busy schedules to be with us all this evening. And I know it's hard because we can't see you as you can see us, but I'm going to ask all of you who are on today's call to please raise your right hand. And again, I know it's hard not to, but panelists, I can see you, and you need to raise them way up as high as you can, everybody who's listening. And then I would like you to bend it at the elbow and give yourself a real strong pat on the back. Because it's not easy. Parenting during COVID, parenting not during COVID is certainly not at all an easy experience. And my husband and I actually had two children who graduated from the Hampden-Wilbraham School District. And just before, COVID, I was saying, oh gosh, I pass Minnechaug and I see all those parents waiting for their children. And geez, I wish I could be back at Mile Tree, or I wish I could be back at Minnechaug. And wouldn't it be wonderful if our kids were young again? I haven't said that once during COVID. I cannot imagine the unprecedented challenge and stress that families endure because of the financial challenges, the challenges to emotional health and wellness that COVID has imposed upon all of us. And, we may all be in the same COVID storm, but we are certainly not in the same boat. So the storm may be consistent, but really the boat in which we are all trying to weather the storm may be different. But I think it's very, very important for everybody to understand that there is help available, and there's help available right here in our community. And seeking assistance for how we are feeling emotionally is not a sign of weakness, but rather a sign of extreme strength. There is absolutely nothing wrong with seeking help, just as we would seek professional assistance for a physical health condition. We should feel just as comfortable engaging the help of a mental health professional. Mental health is absolutely a part of our overall health, and our brains, like our hearts, are vital organs, and each one requires the same amount of care and attention. Seeking a counselor or a therapist is really nothing out of the ordinary. In fact, it's quite ordinary. And through my work with MHA, I've had the benefit of seeing and witnessing the positive outcomes that come with visiting a mental health professional. The Mental Health Association has actually been in existence for about 60 years now. Originally, we were founded by a concerned group of caregivers, parents, loved ones, family and friends of adults who had been institutionalized because of their mental health or their intellectual disability. So you think back 60 years ago to when MHA was founded, and sadly, institutions and hospitals were how individuals with mental health and intellectual disabilities were cared for. The people who founded MHA were staunch advocates and champions for this population of people, and they were very instrumental in what's called the deinstitutionalization movement. And so the Mental Health Association was actually the very first organization in Western Massachusetts to open a residential facility for adults who were exiting the state schools in our area. That was the very first home. It was in Long Meadow, and it is still very strong and in operation today. Best Life is the name of MHA's Emotional Health and Wellness Center. We are an outpatient behavioral health clinic, and we are available to help families, individuals find a boat that's going to help them weather this storm. And our number, 844-MHA-WELL, is up on the screen. And we would encourage you to call, explore, get information, find how it is that we could be helpful. Family counseling, individual counseling. We're also able to provide services via a system we call telehealth, which means rather than having to travel, in addition to everything else that you're experiencing with COVID, between remote work, remote school work, etc., you're able to talk with a counselor from the comfort of your own home. And you can do that on your cell phone, perhaps rather instead. You can do it from your car. You can do it in the lunchroom at work if you're back to work. But it's just a convenient opportunity for people to schedule time with a clinician in an environment that works for them, which is most comfortable for them. We also just briefly, Gina, I know we have other panelists, but I also just wanted to mention that the COVID pandemic has also had an unprecedented impact on substance use and addiction. And Best Life is available to help with substance use recovery and addiction as well. So in addition to mental health counseling, please know that MHA and our Best Life Clinic is here to help people address whatever needs they might have in terms of substance use and addiction as well. Was that
That was
more,
great.
Gina? Less, more?
Oh, that was perfect, Kim. And if you would hang on, as soon as we hear from Kathleen and Carrie, we are gonna get to questions. And I do want time for those questions. So we're gonna move, Kate, if you would move this to the next slide. And Kathleen, where are you?
I'm here.
Hi there. Welcome.
Welcome. Hi. I'm Kathleen Cordier. I'm the family support worker at the Family Resource Center in Ware. I'll tell you a little bit about the Family Resource Center. There's about 27 of them throughout the state of Massachusetts. They are all funded through DCF, but they are run by different individual companies. My company is Behavioral Health Network. We just opened our resource center in August, and so that was exciting, opening up a resource center in the middle of a pandemic. Anyway, I want to give you a little bit of an idea of the things that we do. First of all, I want to say that anyone at all can call us at our resource center. There is no cost for anything. Everything is free. There is absolutely no qualification. You can be any age, you can be anyone at all, and you can be in any income bracket as well. And we will provide you with the resources or the referrals or whatever it is that you need. If you're not sure, you can always call us. And if we're not able to provide the service you need, we certainly will know who can. A few of the things that we do here, first of all, we help people with basic needs, whether it's food insecurity, whether they need help with housing, whether they need help with finding or filing for unemployment benefits or pandemic unemployment benefits at this time. We also help with we also run support groups. We presently have several support groups that we're running. One is grandparents raising grandchildren, because there are, as you well may know, many grandparents raising their own grandchildren. We also have an autism support group. We have parenting classes. One of our parenting classes is called Parenting Journeys, and that is taught by myself and our school liaison. We just began a session last week. It's a 12-week session, 2 hours each week, and it's an evidence-based course. Sometimes people are required to take this particular class, maybe required by DCF or by the courts, or recommended to take it. A lot of times people just want to take the class. And let's see, what else? We also have, I want to make it clear that we work in this area. So anyone who is in the Hampden-Wilbraham area, you know, we work with all of you. We have a staff of about 5 people. We have a director of the program. We have a therapist who works with the family partner. We also have a school liaison person, and we have myself, which is the family support worker. If someone calls us outside of the area, now everything is done pretty much on Zoom because of COVID right now. But for example, if you lived in Springfield and there is a family resource center there, if for whatever reason you didn't wish to choose that and you wanted to call our resource center instead, we would be happy to help you. I can go into a little more detail and also tell you that in addition to what Kim had said, also we also do make referrals for recovery coaches, for substance abuse, substance recovery, domestic violence referrals, and we also provide the resources, and we collaborate with other resources that are in the area, which whatever it is, if you needed help with transportation, let's say, if you needed help with childcare, if you wanted to know how to get services for Social Security or Social Security disability, et cetera, we can help you file those applications and we can guide you through that. I think that's pretty much all I can think of to say right now, because I want to give time to the other panelists here, but I'll be happy to answer any questions. I hope that's okay,
That's
Gina.
Perfect, Kathleen. Thank you so much. And I think what I want to emphasize, and you'll hear from Carrie in just a second as well, and Kim, we're talking about where to get some support for some very concrete needs that you may have right now, or that you may know someone who has these needs right now. And so it does factor into that important conversation of coping and managing with stress, to be able to know where to get the assistance and that assistance is available. Carrie, if you could, and I'm going to ask you to be so quick because I know that there are some questions that we have promised to get to. So Kate, next slide for Carrie, please. And the next slide too, because we've introduced Carrie O'Connor, our family resource specialist from HWRSD. Take it away, Carrie.
Yes, good evening, Community Coalition, MassSupport, and thank you, Sarah, Gina, Kim, Kathleen, Jenna, and all of you for being here and participating. So I am the project coordinator, case manager for the Hampden-Wilbraham School District, as well as I am a coalition member and a legislator. I have multiple years in the field regarding mental health needs, being out there and outreach through, of course, through this pandemic. I have been out there in the community providing support and resources to our students and families within the Hampden-Wilbraham Regional School District. And I have to say, out of over the 20 years that I have been providing support regarding trauma, going even the 2011 tornado, relocation support, mental health, substance abuse, trauma, domestic violence, I bring that knowledge of multiple resources as well as multiple connections within the communities based on the years of support I've been providing students, families, youth, children, and families. So I'm going to discuss a little bit. I'm going to try to be very quick, but if anyone has any questions, please, we have a question and answer for that. So again, I do provide support within the district. There is a triage process. I do provide that direct support going into the homes, of course, with safety, COVID precautions, and the barriers that I have seen have been absolutely heartbreaking at times with what our young children, youth, and families are experiencing. So my role is to help parents, teachers, counselors, community members all over to access appropriate resources based on the individual needs. So here's just a very brief list. The Hampden-Wilbraham Coalition, as well as the school district, we do partner with Behavioral Health Network, which provides a multitude of therapeutic services, all the way from outpatient behavioral therapy to substance abuse to our Children's Behavioral Health Initiative, in-home services, and also services are being held remotely. Clinical and Support Options is another agency that we do network. Again, there's a lot of agencies that we network with regarding assisting families with referrals to get some providers and therapists and support for their children that are in need. We also have the Family Support Network, and I know that Jan Lamberg is on this, and through the Western Mass Training Consortium, which they offer a multitude of parent support groups, which are all virtual, and there will be contact information regarding the Family Support Network, and they're very similar to the Family Resource Center that Behavioral Health Network offers. Also, we have the Western Mass Recovery Learning Center in Springfield for adolescents, young adults, all who are struggling with substance abuse. They have local Alcoholics Anonymous, Narcotics Anonymous, 12-step programs, smart recovery programs, a list of detoxes and rehabs that if any students, family members are struggling, that is some information that you can go to. The Department of Transitional Assistance, again, provides emergency cash assistance. And there is also SNAP benefits that is another resource. And we have our Western Mass food banks. The local numbers are there. So if you're struggling with providing food and just really in a hardship, which a lot of us have been, please give them a call. There's food banks all over. And then we also have the Empowerment Center for veterans and their family members. Any veterans and family members that are struggling, there's an open pantry located in Agawam that all you need to be is a veteran or a member of a veteran to be able to resource over-the-counter medications, ointments, as well as food. And this is just brief resources.
And I want to add, Carrie, that these resources, as well as many others, are listed on the coalition website.
Yeah.
So I really encourage you. And we're going to take a very quick look at Carrie's next slide, which has to do with emergency and crisis services. And these are phone numbers that are accessible. You will be getting a list of these resources when you, for anyone that is registered, and they will also be posted on the website. I'm not sure that I think maybe we should move to questions now. We can leave this slide up, however, so that people can take a look. So Jenna, can you guide us through a few questions that have either come along or were with us from people that had registered?
Sure. So one of the first questions I think we should touch on, it's towards Sarah. What do you suggest actionable steps are an average family can take when they are stuck and unable to be cognitively flexible?
It's a great question. We have all sorts of little things that we recommend trying, like, making a family routine, making a routine for yourself, planning and scheduling family activities. With that said, if you have gone through everything that you can think of and you're still stuck, I'm going to make another recommendation. My first one is you can absolutely call MassSupport Network or email us at massupport@riversidecc.org. We will have a counselor get back to you who can use a tool called Skills for Psychological Recovery. It's a very brief, concrete tool that we use with people, and oftentimes we can help them move through that. With that said, if we go through that process and you're still finding that you're stuck, then the recommendation we would make is that it's time to talk to an outpatient therapist somewhere. And as you just heard, we have wonderful resources in our area, because sometimes what can happen is that cognitive inflexibility, or cognitive rigidity is the term that we use, that can also be a sign that there may be some depression starting. And so what we like to do is try, some of the easier solutions and maybe things that are more comfortable for people at first, but we also have to be open to the possibility that the stuckness may be a little bit more intense than just kind of that surface level being stuck. So that's my recommendation.
Thanks, Sarah. Jenna, what else do we have?
All right, so this one is regarding resources. When the demand of technology overloads a child's brain and their ability to cope with everything, are there any home supports that are available to people?
So I'm thinking maybe either Carrie or Kathleen or Kim, really anybody can jump in here. I'm not sure what the asker means by home supports, but when people are kind of overwhelmed by that overload.
I can answer that question, Gina. I know that in our local area in Hampden-Wilbraham, the YMCA in Springfield and Wilbraham do offer additional support for remote support through before and after school programming. So that is something that might be helpful. And also there are other supports out there with in-home services that could probably help with the transitions, the structure. But we do know that the remote learning, a lot of our kids, young adults, they are struggling with that piece. And so we do I have to say that we do a lot of support within the school first, and to see how we can accommodate those kids, or our adolescents, and then from there we would refer out to the appropriate resources.
And I
If-
want to mention too, that we have people with us today that are from other school districts. So, I think just bear in mind that connecting, communicating, sharing your concerns, and then engaging in those folks to help problem solve, no matter what school district you may be working with, is important.
Gina, if I could just quickly add, for those of us who work in this field, for those of us who day in and day out are in this industry, or who are school professionals, it's very easy for us, and it's very top of mind for us to know what resource to call or what resource to seek out. But for so many families, this is really very new, uncharted territory for them. And so I would just offer that I put my email into the chat. I don't know if everybody was able to see it, but there is help that's available to help you navigate. So don't feel that you have to seek resources individually or independently. There are many of us who are available in this community, in your community, who can really help you through that process, really hold your hand and make sure that you are getting the support and you're aware of the supports, because there are many that are available in your community. So first and foremost, don't feel that you have to go through this alone, because you don't. There's lots of resources that are out there and available to help you navigate through all the different services that are available.
This is Kathleen. I just want to echo what both Carrie and Kim are saying, which is in the Family Resource Center, we as well can speak with parents and teach them and help them with advocating for their children in school and making sure that their children are getting what they need and how to go about that. So same here, and my contact information is in the resource.
And I do want to add for Kathleen, as well as what Kim said and Carrie, also the resources that may be not necessarily in the school, but also in the community. And so some of those solutions may be in that wider circle of our lives. How about the next question, Jenna?
Okay, so the next question, what type of developmental delays might we see in our kids, considering they haven't had typical experiences over an extended period of time? Is there an impact that we should be aware of when it comes to expectations for them?
I'd like to take that question if you don't mind. I wanted to say something a little bit different, perhaps. The way that I looked at that question was what I've been understanding from a lot of the therapists and a lot of my other coworkers, as well as myself working, is that I see a lot of children who have become incredibly resilient during this period of time. And what they've done is that they have turned things inward, and they have really focused on their relationships with their family members. And the teens in particular are so incredibly adaptable, which is a wonderful strength to have, obviously, in life. And they have had to reach out across the internet and be able to learn how to navigate their whole world of connections through the internet. And they have done that incredibly successfully. I don't know. I just want to say that there's some real positives that have come out of this, and I think the teens in particular have really done a wonderful job.
And I would just also add to that quickly is that if folks have time, there was a wonderful article that was published in the New York Times on September 30th, 2020. It was actually updated on December 10th of 2020, and it quotes Dr. Erica Hernandez, who is a postdoctoral scholar of social development at Penn State. And basically what was very reassuring in her article was the fact that, certainly there's a huge cultural variability in terms of what we consider to be a social norm in terms of engagement. But basically at the end of the article, what she got around to saying was that she felt our kids are going to be just fine. She really felt that at the end of all of this, with the right kinds of supports and the right kind of family network, that our kids would be okay. And to that point, just very quickly, again, my kids are 18 and 20 and perhaps much older than some of the parents on the call today. But there was one thing that we did with our kids at least once a month, and we talk a lot about this at MHI, and that is to just have mental health check-ins. So just as you would have a check-in with your children in terms of how they were feeling physically, take a time each month to just set aside an opportunity, unplug, unwind, and just ask them how they're feeling. How are you? Is just a simple question with 3 words that can really elicit the type of response that parents will want to hear from their children in terms of helping them to better understand how they are feeling emotionally. So have those conversations, start talking. Don't be afraid to ask them how they're feeling emotionally.
Thank you.
They'll tell you.
They will, and be ready to listen.
That's
And
the other part.
And I would add to that, is there someone in your life that can ask you, how are you? Because that, the self-care aspect of this is important. We are at the end of our time together, and I hate to cut this short. Kim, there was one request that you put that resource in the chat. We will summarize our notes from tonight, the questions from tonight, and we will be sharing those in a summary of tonight's program as well as the link. It's going to probably take a couple of weeks before you see that, but if you were registered and we have your email, you will get that. If you were not registered, don't hesitate to reach out. And Kate, if you could just give us the next slide really quickly. Yes, thank you. We also offer from the Coalition Youth Mental Health First Aid Training, which I strongly recommend as an opportunity for you to learn signs and symptoms of mental health, learn a little bit. It's not to learn how to make a diagnosis, it's learning a strategy that you can use. And guess what? One of those action plans is that whole idea of listening non-judgmentally, exactly what Kim was just talking about. We can do mental health first aid courses for groups of a minimum of 5. So if you can collect 4 other people and call me up, we will schedule a class for you. We have space where we can do this safely in person, and we're in the process of getting certified to do it virtually as well. We're not quite there yet. Kate, can we see one more slide? Yep. So there's our QR code one more time, and the link, but the link for the evaluation is there. Please take a moment. I know it's been a long night, and I so appreciate your help and your attention and your participation. A big shout out to Kate Belsky for keeping our slides moving. If we did not get to your questions, please promise that you will put them in writing, send them. You see my email there, gcon@hwrsd.org, and I will make sure that they get routed to our panelists, who I'm sure you can tell will be very happy to answer those questions, and then we can post them online on the website for everyone to share. I truly appreciate Jenna's work and getting those questions relayed to us. Our amazing panelists, Carrie and Kim and Kathleen, Sarah and her, she had a behind the scenes partner, Anastina, who I know was instrumental in putting the presentation together. And most of all, those of you who took the time tonight, who hung in there with us. I had promised that we would maybe leave earlier, and I have kept you a few minutes beyond. And for that, I hope that every minute was worthwhile. Take care of yourselves. please hang in and draw your strength from those places that you have available to you, including those great resources that you heard tonight. Stay in touch with us, come back to our programs whenever possible, and keep in touch. Let's keep the conversation going. Thank you so much